Section 1. The nature of compulsions. An overview. Compulsions are repetitive behaviors or mental acts that individuals feel driven to perform. These actions are often performed in response to obsessive thoughts, which are intrusive and distressing. Examples of compulsions include excessive hand-washing, checking locks repeatedly, or arranging objects in a specific order. These behaviors offer temporary relief from anxiety, but the relief is fleeting. This leads to a cycle of obsessions triggering compulsions, which only strengthen the obsessive thoughts. The distress associated with compulsions can be significant, impacting daily activities, relationships, and overall well-being. This cycle can be incredibly isolating and frustrating for individuals struggling with compulsions. Recognizing the nature of these behaviors is the first step toward understanding and seeking effective treatment. Section 2. The roots of compulsion. Understanding the causes. Compulsive behaviors often stem from a complex interplay of genetic, biological, and environmental factors. Research suggests that certain individuals may be predisposed to developing compulsions. This predisposition can be influenced by family history of anxiety disorders, differences in brain chemistry, or early life experiences. Neuroimaging studies have revealed differences in brain activity and structure between individuals with OCD and those without the condition. Environmental factors such as stressful life events or trauma can also play a significant role in triggering or exacerbating compulsions. Understanding the underlying causes of compulsions is crucial for developing targeted and effective treatment plans. Section 3. The vicious cycle, compulsions and their impact. Compulsions thrive on avoidance. When we engage in compulsive behaviors, we reinforce the belief that our obsessions are real and dangerous. This avoidance prevents us from learning that the anxiety associated with our obsessions will naturally decrease over time, even without performing the compulsion. This avoidance creates a vicious cycle. The more we avoid, the stronger our fears become, and the more compelled we feel to engage in compulsions. The time-consuming nature of compulsions can lead to decreased productivity, missed opportunities, and strained relationships. Individuals may experience shame, guilt, and frustration over their inability to control their compulsions. They may withdraw from social situations, fearing judgment or scrutiny from others. This isolation can further exacerbate anxiety and depression, perpetuating the cycle. Breaking free from this vicious cycle is possible with appropriate treatment and support. Section 4. Breaking free, effective therapies for compulsive behaviors. Therapy plays a vital role in helping individuals understand and overcome their compulsions. Cognitive behavioral therapy, CBT, is considered the gold standard. CBT focuses on identifying and changing the negative thought patterns and behavioral responses that contribute to compulsions. Exposure and response prevention, ERP, a key component of CBT, involves gradually exposing individuals to their feared situations while preventing them from engaging in their usual compulsions. This process helps individuals learn that their anxiety will naturally decrease over time, even without resorting to compulsions. Other therapeutic approaches, such as acceptance and commitment therapy, ACT, can also be helpful in managing compulsions. It's important to work with a qualified mental health professional experienced in treating OCD and related disorders. Section 5. Cognitive behavioral therapy, challenging and changing thoughts. Cognitive behavioral therapy, or CBT, is a structured, goal-oriented therapy that focuses on the interplay between thoughts, feelings, and behaviors. In the context of compulsions, CBT helps individuals identify and challenge the negative thought patterns that fuel their anxiety and drive their compulsions. These negative thoughts, known as cognitive distortions, often involve catastrophic thinking or overestimating the likelihood of negative outcomes. CBT helps individuals recognize these distorted thoughts and evaluate their accuracy. Through guided questioning and behavioral experiments, individuals learn to challenge these thoughts and replace them with more balanced and realistic ones. CBT empowers individuals to take control of their thoughts and break free from the grip of negative thinking patterns. Section 6. Exposure and Response Prevention. Facing Fears, Regaining Control. Exposure and Response Prevention, or ERP, is a powerful behavioral technique used to treat a wide range of anxiety disorders, including OCD. ERP involves gradually exposing individuals to their feared situations or objects while preventing them from engaging in their usual compulsions. This process helps individuals learn that their anxiety will naturally decrease over time, even without resorting to their compulsions. The exposures are typically conducted in a hierarchical manner, starting with situations that evoke mild anxiety and gradually progressing to more challenging ones. By resisting the urge to engage in compulsions, individuals allow their anxiety to naturally subside, a process known as habituation. With the support and guidance of a trained therapist, individuals can gradually overcome their anxiety and regain control over their lives. Section 7. Medication, a supporting role in treatment. While therapy, particularly CBT and ERP, are considered the first-line treatments for compulsions, medication can play a supportive role in managing symptoms. Selective serotonin reuptake inhibitors, or SSRIs, a type of antidepressant, are commonly prescribed to help regulate serotonin levels in the brain. SSRIs typically take several weeks to start working, and it's important to note that they are not a quick fix. They work best when combined with therapy, addressing both the biological and psychological aspects of compulsions. The decision to use medication should be made in consultation with a qualified healthcare professional who can assess the individual's specific needs and medical history. Medications, combined with therapy, can provide significant relief from compulsions, allowing individuals to engage more fully in therapy and make progress towards recovery. Section 8. Hope and Healing, Real-Life Stories of Recovery. Countless individuals have overcome their compulsions and gone on to lead fulfilling lives. These stories of resilience and recovery offer hope and inspiration to those still struggling. Consider the story of Sarah, a young woman who battled severe hand-washing compulsions for years. Through therapy, Sarah learned to challenge her negative thoughts, gradually exposing herself to feared situations and resisting the urge to wash her hands excessively. It was a challenging journey, but with perseverance and support, Sarah broke free from the grip of her compulsions. She re-engaged in activities she once enjoyed and rebuilt relationships that had been strained by her condition. Many individuals have found freedom from compulsions through therapy, medication, or a combination of both. These stories underscore the importance of seeking professional help, challenging negative thoughts, and gradually facing fears. Section 9. Finding Support. Resources and strategies for individuals and families. Living with compulsions can be challenging, not only for the individual but also for their loved ones. It's essential to seek support from qualified mental health professionals, support groups, and trusted family members or friends. The International OCD Foundation, or IOCDF, is an excellent resource for finding therapists specializing in OCD and related disorders, as well as support groups and educational materials. Family members can play a vital role in supporting their loved ones' recovery. Education about OCD is crucial to understanding the nature of the disorder and avoiding unhelpful behaviors that can inadvertently reinforce compulsions. Self-care strategies are also essential for managing anxiety and reducing stress. Taking care of one's physical and emotional well-being can significantly enhance the effectiveness of therapy and support overall recovery. Section 10. Embracing change, reclaiming your life. Overcoming compulsions is a journey that requires courage, commitment, and support. It's about challenging deeply ingrained thought patterns, facing fears head-on, and gradually reclaiming your life. Remember that change takes time and effort. There may be setbacks along the way, but each step forward, no matter how small, is a victory. Celebrate your successes, no matter how insignificant they may seem. Each time you resist a compulsion, you are rewiring your brain and strengthening your ability to manage anxiety in a healthy way. Embrace the uncertainty that comes with change. Focus on building a life that is rich in meaning and purpose. With the right support and unwavering determination, you can break free from the grip of compulsions and create a life filled with hope, purpose, and possibility.